Repeat that point. I don't understand it.
What I'm saying is, Gurexi, which is one of Baba's people,
Mm-hmm.
came online and said that they asked Baba if he wanted whatever money that was left from Westo, from not Westo, that was left from spending, the money they are arguing about.
Mm-hmm.
And Baba said no, he doesn't need the money, they should leave it for spending, which is one of the key facts that will let us know that Baba is aware of the donations and where they are going to and what they are using
Exactly.
the donations for.
Exactly. So he know, to be honest, from the day one, Baba know everything. Baba know what is happening. So for him to allow them to release all this guy, because tó bá jẹ́ pé lóòótọ́ ikú ọmọ ẹ̀ ò dùn ẹ́ lóòótọ́, ò ní jẹ́ kó release ẹ̀. Even though tó bá tiẹ̀ ń gbọ́ pé they are contribute money for them, wàá sọ pé ta ló fà, kí ló fà? You supposed to be going to the police station pé they must not release them. And then you are the one that gan sef pé kó release wọn. So he knows everything about all this issue. Wípé kò mọ̀ ń pa ẹ̀yẹn, zero ni, 0% ni. He knows everything. So for him to say, if owó yẹn lẹ̀ fún ẹ jẹ́ kó máa ná, you don't even have the right to say that pàápàá. So 0% ni, he knows everything from day one. So bẹ́ẹ̀ bá ṣe ń sọ ìṣàkàṣà máa sọ tí tó bá fi débi tó yẹ kó dé, they will learn in a hard way pé you kí ń pè èèyàn bẹ́ẹ̀ yẹn, as even for you as a father, ìwọ náà ló wá tó wá pẹ̀ láwọn tí ọ̀pọ̀ tó pa ọmọ ẹ̀ láti release wọn, you will learn. Tó fi ń parọ́ mọ́ ọmọ ọlọ́mọ tí ò mọ̀ nǹkan, tí ò mọ ọwọ́, tí ò mẹsẹ̀, you will learn. And you said that you went upstairs, you saw a pool of blood. Where is the pool of blood? You did not mention anything like that. In the first place, when you took this boy, you never shout out. So as up were panic, you are not panicking at all. So they know all what they are doing. From upset from day one till now. October is quiet after they did all what they wanted to do. Because that to mention for concept pé ọlọ́ba manager ẹni ìlọ́ba ọmọdé kò dẹ̀ mọ́ ẹ̀kọ́ lọ bóun náà òun accept why tí manager yẹn ṣe lọ bá ọmọdé after tó bẹ̀rẹ̀ ẹ̀ tán, why such a thing supposed to be happening. So kó gbà pé kó pa ọkọ òun kó dẹ̀ settle òun out. Who will do that in this life? And tó bá lo love tó dẹ̀ jọ kó ẹ̀ ní bàbá ọmọ ẹ̀, wàá dẹ̀ gbà kó settle ẹ̀ out of court pé òkè má jà lọ court, yà gbàgbé ẹ̀ síbẹ̀, àtọ́jú ọmọ àti ìwà àti ìwọ náà. Mi gbọ́ rí láyé mi. So ọmọ ò dẹ̀ ní jẹ́ snitch fún ọkọ ẹ̀ because the love is there. Tó bá ṣe bẹ́ẹ̀ gan sef, òkú máa jà. Yeah, the boy will fight. So bá ṣe ń gbé lọ ní ká máa gbé lọ. President wọ́n ti lọ o. So òkú máa jà. Bàbá Alọ́ba, you did well o. I know you'll be hearing us o, because somebody said that you always screen us when we are talking. I know you'll be hearing us. Alọ́ba, you need to come out and explain what happened, what you did in the secret you are hiding. You need to come out again and say to the world that this is what you did and this is what they asked you to do. For that, probably you may not go to where you're supposed to go to. But if you don't come out and explain yourself, then what will happen will happen. Then you will know that you are on the wrong side. Because àgbà pé wọ́n kọ́ ló ṣekú pọ̀ ọmọ ẹ̀, but you agree they should give you a percentage and you accepted it. So for that, you need to come out and explain yourself. But if you did not come out, what will push you out will push you out. What will open all the case will open the case. Then the whole world will know what you are hiding. That's all. Ṣé dáwà ṣì wà ń bẹ̀? Ẹ máa sọ̀rọ̀ lọ dáwà.
Yes, I'm here. Yes, I'm here. Now, there's this allegation that they said that they found other injections in the house. Now, I've been trying to, that was why I muted myself. I've been trying to research on these injections. And it was said, okay, I'm going to be reading what the Commissioner of Police said on October 6th. I'm reading from the Vanguard newspaper, and it's saying, he highlighted actions undertaken by the Special Investigation Team in the course of the investigation to include exhumation and autopsy on Mohbad's body, toxicology tests, which results he said were still being awaited, as well as visit to Mohbad's house, which was described as the crime scene, to review the closed circuit television footages. That's the CCTV, covering days of the incident, which he said was out of order. The engagement led to the recovery of remnants of the drugs, injections, and other test kits administered by the auxiliary nurse, including one tetanus toxoid injection. Okay, that means I'm beginning to ask myself some questions. This nurse, was she planning to bombard Mohbad with all these injections? One tetanus toxoid injection, that's for tetanus. She had three used syringes. That means one for she had already injected him with tetanus toxoid, injected him with paracetamol and cetrazone. So it means that these are the three used syringes, but she still had one more tetanus toxoid injection. So please, nurses in the house, please, you're going to help me with something. Two used syringes filled with suspected medicine contents. They didn't tell us what were inside those syringes, that the syringes were filled with medicine contents. She had not administered them. One packet of cetrazone solution. She still had cetrazone. Oh no, it's not cetrazone. Ceftriaxone. Okay, ceftriaxone injection. Procaine penicillin. Procaine penicillin is another antibiotic and anesthetic.
Yes.
Because I'm
Yes, it
trying to
is.
read it now. Good. So it's actually telling me it's another antibiotic. It's also a local anesthetic. Okay. So that's procaine penicillin. Empty broken empty broken of diclofenac injection. Hold on. Diclofenac. I want to just see what it is used for. Okay, diclofenac injection is a non-steroidal anti-inflammatory drug, NSAID, used to treat adults with mild to moderate pain.
And
So I
that's for
think this is a
pain.
pain. Yeah, pain represents. Okay, good. Where am I? Paracetamol diluted with water, water for injection, 6 hand gloves, 1 bandage, 1 plaster, and 1 iodine solution. Also separatable recovered is the mobile phone of the deceased. All were registered as exhibits, Owohunwa said. Now good. In all these things, was there a drug used for something else? No. She only administered 3. Sorry, the person that spoke just now, sorry, please, are you a nurse, please?
I'm an healthcare provider, so I'm able to answer as much questions as you need me to.
Oh, okay, please. Oh, okay, please. Now, can you combine cetrazone with diclofenac?
No.
You can, because diclofenac is for pain, while ceftriaxone is just an antibiotics.
Oh no, which one did I ask? Okay,
Or
procaine
do you mean
penicillin.
like
Sorry.
procaine penicillin? You can
Yes.
have you can take up to 3 antibiotics together, but it all depends on how often you are taking it, if that makes sense. Also,
How do you question? Okay.
the procaine penicillin, did she use it like a antibiotics at that time, or was it used like just for, let's say, like lidocaine, which is just to numb something,
She,
if that
she
makes
had
sense?
not used it. She had not used this.
She didn't.
She
She
only
didn't use
used
that.
3.
Okay,
Yeah, but they found it at the scene.
so it's
What
it's
she
it's
only she
serving
only
the same
administered.
purposes.
Okay, she only administered tetanus tetrazone. She administered paracetamol intravenous and also administered ceftriaxone. So it was the cetrazone she administered that he was reacting to, that he was uncomfortable. They should remove it, and he started vomiting. He had goosebumps all over him. Then he started convulsing.
Yes,
Out of all these drugs, it was only the cetrazone that he quickly reacted to. I'm listening to you.
yes, that's very possible. That can be like an anaphylactic shock if he's not able
What
to
do you
take
mean?
that
Your grammar is will be getting too much.
I don't know how to explain these things in layman terms, but that could be like if you're allergic to a
The shock you said
medication.
just now.
Yes,
Okay.
if you're allergic to a medication and somebody is giving it to you, the first thing it's going to affect is your breathing. You're going to see goosebumps and all that stuff. But my question to this nurse, that the first question that is coming to my head is, did she come see the patient, went back to the pharmacy to get what she needs, and then came back, or she just brought all the medicine without even seeing the patient? That's the question that is coming to my head.
She didn't see the patient.
So that's definitely something is wrong somewhere.
She was sent a video of the arm, the injury, via a short video. She saw the arm, then she came with the drugs.
Dawa,
Yeah.
the nurse, she was coming directly from where anywhere she was coming from, and she
Yeah.
passed out the pharmacy, get all the
Yeah. Before
drugs
coming.
before
Yes.
coming, without even
Yes.
asking the earth. How should I put it?
And it was when she got there. It was when she got there that they told her that he has ulcer.
So though, if they ask, if they should told her that she has ulcer, does she ask
Yeah.
him, have you eaten or something like that? And put that
Yeah. He
without
had eaten
ulcer.
Indomie. He had eaten
Not just
Indomie.
that, not
Eaten
just that.
Indomie.
When it comes to antibiotics, the first thing doctors tell you is, do you drink? Do you
Exactly.
smoke? When
That
you're
is
taking antibiotics, you're not even supposed to drink liquor.
that is why I'm
He
coming from.
actually
I'm
he,
just
So
he actually did that. He actually
that's
did
what I'm
that.
saying.
He Yeah. He
So she
actually
didn't
did
even
that at the
assess this
show.
patient first. She didn't know what's going on. They just told her, oh, this is the wound. And then she just went to the pharmacy, got whatever she needed to get, and then came. And also, what do you need two tetanus injection for? Because you're only supposed to get one.
and then why did
Why did
you
she buy two?
exactly why did you mix paracetamol with water? I've had that before in my life. No, you shouldn't.
It's the injection, I think.
Maybe saline, not water. Maybe saline. Probably saline.
So injection.
Maybe saline.
Okay. I mean, there's
Okay.
something hiding.
Sorry. The next question I want to ask. Sorry. How many minutes do you need to push in cetrazone into the body?
At least 5 minutes if it's given IV.
Yeah, it was given IV.
Yes, at least 5 minutes. And usually
What
cetrazone,
quantity?
we give it every I can check. Let me check if I have anybody that's taking that right now. Usually it's usually like, let's say maybe 10 milligram, but let me confirm before I say something.
Anyway, everything was wrong because nurse injection, it was totally wrong. It's only doctor, so it's total. I could ask. uh I could understand that they can give a drip, but injection no.
Anike Habs, good morning. Okay, while she's going to get us this information, please, I'd like to say something. For those people coming to my DM to curse me, what I'll just tell you is this: don't blame me if people close to you start dying, or you lose your job, or so many disasters start happening to you. Don't blame me. Don't blame me if misfortunes that's happening to you, don't blame me. I never called out anybody's name here, and all I do is justice for Mohbad. Now, if you think what I say is not same as your own opinion, it's fine. But you now coming to a DM wishing your enemies dead, wishing your kids dead, and things like that, it's uncalled for. It's uncalled for. It is justice for Mohbad, not justice for Dawa. It's not justice for Timmy, it's not justice for King White or something. The people that this talk concerns, they are the court. We are only analyzing in our own little way. So you come into people's DM, cursing and doing things like that. I don't have issues, so you can continue. It doesn't bug me. But the thing there is just this. Don't come back to beg me. Please, don't come back to beg me. When you start seeing misfortunes, maybe you lose your job, or your kids start dying, or you just have an ailment that money cannot resolve, or cannot give you the proper diagnosis, they'll carry you from heaven to from earth to from Nigeria to anywhere, and they'll be telling nothing is wrong with you. But your body is now getting you're now getting bloated, or you now feel uncomfortable inside. Don't come and beg me in my inbox. So when they tell you that somebody is doing you, I won't do you this thing. No, my own na prayer. My own na prayer, and I know God does not disappoint. God does not disappoint. That
Okay, I'm back. Sorry.
okay.
Sorry, yes. So according to what I was able to get from my Pixis, usually we can give 1 gram, 2 grams, or we can give 500 milligram, which is half of a gram.
Okay, I heard of the 5 milligram. Yeah, I heard about that, but I'm not
500
too sure.
milligram.
500 milligram. Yeah, I'm not
Yes.
too sure. I'm not too sure if that was what she administered. Now, if you're applying this thing intravenously and this person has a history of high blood pressure, do you still push it in 5 minutes or increase the amount of time to push it in?
You're still able to push it at that time because that doesn't really affect your blood pressure. But I think it all depends on, are you allergic to this medication or not? And one
Now,
common medicine that people are usually allergic to, which I think might be the case as well, is penicillin. It's very common.
Okay. Concerning the antibiotics, like BNF here in UK, before you can administer it, because it contains penicillin, you need to ask the patient. I don't know what the nurse did because of the urgency of the situation. It has to be administered between 30 to 60 minutes.
I don't think she gave the penicillin. I think she gave the ceftriaxone. And usually ceftriaxone, you can IV push it in the ER. Even on the floor, if it's an emergency like
Yeah,
ICU, IMU, you can.
But it has to be between 30 to 1 hour. She gave it as IV.
Yes.
Yeah, it has to be between 30 to 60 minutes.
Are you talking about penicillin?
I'm not talking about penicillin. I'm talking about, what's it called?
Ceftriaxone?
Yeah.
No, I think that it depends. Maybe that's UK rule, but if you're in the US, we can push it in 5 minutes.
How do they do it in Nigeria? That's the thing.
That I don't know. That I can't answer. And usually Nigeria goes by whatever UK does most of the time. But for US, yes, we do push it in the ED. 5 minutes, yes, we can.
But like my trust, like 1 gram, you can't bolus it. You can't push it. Some trusts allow it. It depends on individual trust policy.
Yes. And also it depends on how many milligram or grams she's given. We don't know.
Like with my trust, you have to put it in 100 mils of normal saline, and it has to be between 30 to 40 minutes. You can't push it. You are right, ma. You are very right. And it was doctor that will give you the
Yeah, you can't just you can't just buy it or you yourself. No,
no.
No, but
even
Nigerians buy
yeah, I know
medicines in
about
pharmacies.
Nigeria, but the question is, where does the nurse, where did she get the medication from? Because they've been saying a lot about this nurse. They've been saying a lot about this nurse. Nobody has ever questioned where is the pharmacy, the name of the pharmacy, where is her receipt?
Even though he got the receipt got missing, you can still go back to the
Yeah, you can
pharmacy
still,
where
she
you
can
get
still
it
go
from.
back. She can still
Yes.
go back to the pharmacy.
And
In Nigerian pharmacy, they are not dumb.
There is no pharmacy. Most pharmacies have CCTV. That's those that are big. And I don't think you can just go to a local pharmacy in Nigeria and get a ceftriaxone injection.
without the doctor
Number one,
prescription.
yeah, you'll be given a doctor's prescription. Now, she doesn't have a doctor's prescription. She's an auxiliary nurse. How did she convince the pharmacy to give her ceftriaxone? That is something we should ask. Did she forge a receipt or a doctor's report? These are questions that we need to ask ourselves. Did she forge a doctor's report? Which pharmacy? I believe if she points out any pharmacy, they would have deleted whatever they have in their possession. In fact, in their books, they would have removed all the ceftriaxones they have there. That they are not even selling it again. Not in Nigerian pharmacy.
Mr. Dawa,
Yeah,
in Nigeria as well, there are a lot of fake medication.
But not
exactly.
sir, ma, not that kind of drugs, ma.
I'm telling
There's
you,
Those
fake for
drugs,
anything in
pharmacy
Nigeria.
wouldn't sell it honestly.
There's
Ma,
That's
fake
just
for
normal
anything in
Ma,
person.
Nigeria.
I'm
I'm
touch.
Don't
telling
say
you,
that.
I'm
Don't trust
telling you,
Nigerian pharmacies. Don't trust the Nigerian pharmacies.
Ma, I'm telling you, before I left Nigeria, I work in an hospital, big hospital, owned by one Batejo show. All these top people normally comes there. Can you imagine our own pharmacy?
Mm,
We buy fake medication,
mm,
fake drugs, fake injection.
mm,
And also, can I also add, I
mm.
don't think there's any body of government in Nigeria that's actually regulating people being able to buy over the counter medication, whatever medication they
No,
want to buy without prescription. I
no,
don't think there is any.
No, it's
no.
free for all, man.
No,
Exactly. So we don't even know if the pharmacy was like, what do you want to buy? I mean, they wouldn't expect somebody that doesn't know anything about a medicine to just walk and tell you a name of a medicine, if that makes sense. So, of course, she knows, okay, maybe this is what I can give. They probably can just sell it to her just because she asked. That's very possible.
Mm,
Now, even if the pharmacy wants to
Nigeria,
sell,
you can
even if
just
the
walk into,
pharmacy, yeah,
you
even if the
can,
pharmacy wants to sell, someone like Med Plus, I know a pharmacy like Med Plus, that's where I get most of my drugs. There'll be a doctor, a pharmacist, a qualified pharmacist in their midst. No matter the drug, the person is going to tell you, use it so time, do this, do that, do this. Was this nurse even advised on how to use it? Why is she with two injections of tetanus toxoid? Why is she with two? Why not just one that she needs?
That is the part that I'm a little bit confused about because what do you need two for? It's like taking a vaccine and saying, oh, I want to take two. For what?
she was planning ahead.
Now, I just want to ask another question. Okay, now good. Once you see this side effects that led to convulsion, is there any antidote to use for such a drug?
it should be, but it should be in the hospital.
There is, but already at that point, it's already an emergency.
Exactly. If it's in the
Oh,
hospital, they will sort
It
it out straight
they
away.
can because in the hospital you can easily say, okay, maybe let's give fluids as much as we can to flush
To
whatever
flush
we've
it
given
out.
this person out.
I
Yeah.
want to ask a very strange question.
Go ahead.
In Nigeria, when people are convulsing, what we do here is one, we pour water on the person. Two, we try as much as possible not to allow the person close his mouth, his teeth. Do you think this is clinical?
No.
It's
No.
not. But I feel
No.
like Nigerian treats everything like somebody's having what we call epilepsy.
Ex-
Regardless of what's going on with you, that's the way they treat it. Which is not
So
even safe for you to put your hand in somebody's mouth while they're having a seizure or something like that.
even spoon, we never used to do that.
What it is simple thing that they can do. You can turn the person to the left side, put the pillow on the head of the person.
Hmm.
Okay, now, while someone is convulsing, can you move the person like, in a vehicle, or like the person receiving fresh air or something? Is it advisable, or the person should just be put in a controlled environment?
It's supposed to what the lady said now, and what the madam said now. That's what they're supposed to do.
Just
But
record position. Turn
because
left.
Not allowing the person's head jerk,
Yeah.
right?
But
yeah,
if you need to time it, if it's more than 3 minutes,
they call the ambulance
that's a serious
issue.
That being
yes.
said, it also depends on what's causing the convulsion. What Miss Pretty Lady is talking about right now is basically epilepsy seizure like. Having a medication reaction, you are convulsing, but at the same time your airway is closing up on you. So we need to know the difference between what's happening.
Okay, now this is why I'm asking the question. The nurse came. It is not in a clinical environment, it's in the person's house. After she administered this guy was uncomfortable. He said he's feeling heat from the inside. He said they should pour water on him. That was before he started the convulsion. He went to the toilet, he vomited, he came out with goosebumps, and he said it was uncomfortable inside, like internal heat, that he wants to go to where there's an AC. He went to his son's room where the AC is working. It was there the convulsion started. Now, that was not a clinical environment in which maybe he could be treated or given an antidote on time. Now was the rush to the hospital. The rush to the hospital would involve a convulsing man being carried. We don't know how many people carried. It involves, because they have to rush him for help. He was on the way, he was already getting cold, and he was taken on a bike. Obviously, on a bike, you would have jerks, your head moving around, jerks from bumps, from the road bumps, and things like that. Until he got to the hospital and he was declared dead on arrival. Now, do you think one of the major reasons why he actually died on the way was because, one, when you're being transported on a free air, that is a free rush of air, that is like on a motorbike. It's not like you're breathing very well, but you're just picking air in motion. Could this also facilitate the death? Please, I don't want any cry emoji, please. Nurses in the house, please help respond to this, please.
Okay, Mr. Dawa,
Yeah.
the first time Mohbad complained about the symptoms when he went to toilet, the nurse continue with the administer of all the medication.
No, it was only, she stopped at number 3. He was complaining that they should remove it. That
And she stopped.
it's paining him. It's paining him, and he was taken to the toilet. That was where he vomited, and he started having goosebumps. Then the nurse rushed to go and get something at the pharmacy. While she was there, he was already convulsing, and they had to call her to come back. Then they were looking for a vehicle to transport him. It was on the way. There was traffic. The neighbor carrying them said he's getting cold. He touched him and said he's getting cold. So they got down, took a bike. Somebody stayed at the behind, and he was taken to the first hospital, which was Kuramed Hospital.
Because with my experience, at that moment, Mohbad need medical emergency. Why would they not leave him?
What could she have done? Was there a drug to had helped
But
aid?
she doesn't have any antidote medication with her.
She wasn't. I just read the list of drugs that she brought. She said she wanted to go back to the pharmacy to get something. Now, the issue here is this. Somebody followed her to that pharmacy. To the second pharmacy. I don't know if it's the first, that's the pharmacy she procured it first. But she says she's coming, she wants to get something from a pharmacy very close to them. So somebody followed her. Now it was when she was there, she was called that he's already convulsing, that they need to take him to the hospital. So my issue now is this. The person that followed her to that pharmacy should provide the pharmacy. That's which pharmacy did you go to? Did she go to? If she doesn't want to provide where she got the initial injections, if she says she has forgotten or this, no problem. The second pharmacy, where was it? Is it the first? Is it still the same as the first pharmacy? Then they need to pack everybody there in the pharmacy. Now, sorry, I don't know how long the convulsion lasted. But it was within an hour. From the police investigation, she said she got to the house 2:30 p.m. She started administering 2:40. You could read this. You could listen to this on TVC press. Just put on YouTube press conference of police press conference on Mohbad. It will pop up. There's a 34 minutes video. The commissioner of police explained all this. All these things I'm saying, the commissioner of police explained all this. So, and it was said he died around 3:30. So it wasn't up to an hour. All these things I'm saying wasn't up to an hour. And it was said that they rushed him to a second hospital, and the distance between the first and the second was about, was it 15 or 20 minutes? 15 to 20 minutes, yeah. So that's it. We've analyzed quite a lot. We've asked a whole lot of questions, and it's just painful that all these questions, it is until when they are answered, we can actually get to the... So my next question is this. Gentle girl, I need you to help answer this question. It has to do with toxicology. First of all, have you witnessed an autopsy before? Or can you just give us an insight of what an autopsy looks like?
I have not. That is not no no.
You don't, you don't have
That
the guts to.
Now
You don't have
research
the
for
guts
it.
to.
that I cannot do.
That one.
Nam?
I researched for it during the time that they wanted to do the autopsy. It was very bad. They have to cut the person like cut everywhere to get what they wanted to get, even the score. So it was really bad. It wasn't good experience at all. And the doctor was saying the other day when I was researching it, he said that it's not the best to do. Even some family does not accept it because their cough won't sleep well. So if you don't want to do it, you don't have to do it. But it's not the best to do. It's very horrible. That's what I had in the researching. So it's not the best at all to do. It's very even that day I was very upset. I couldn't sleep when I saw it. I went on YouTube, then I researched for it. So it was very painful. So I don't know why this man said he wanted to do the second one. Like, are you joking me? Can you go and check what autopsy mean? That's what I was asking myself, talking to him, talking to myself as if I'm talking to Aloba himself. So it was not a good sign at all. Autopsy is not good at all. So that's my own opinion.
Okay, gentle girl, toxicology, what do you think it means? Some of us have knowledge about it, but we need from a medical
I
person.
wanted to say something.
Okay, please go ahead, please. Maybe a sample or an animated video.
I do have one. Do you want me to send the link to Statemi or do you want me to send the link to you?
You could send the link to me. Is it on YouTube?
Yes, it's on YouTube.
What do I have to search for on YouTube?
Can you hear me? Search for detailed animation video of how an autopsy is done. The 1 minute long. I think that one is too long.
Oh, okay.
Did you see it?
It has about 549,000 views. Is that it?
No.
Is that the video?
Yes.
Okay, good. It's about 8 minutes 20 seconds long, right?
Yes, exactly.
All right. And if you look at Nigeria, generally in Nigeria, everything about Nigeria is fast track. They just want to do things in their own way. And moreover, this nurse is an auxiliary nurse. She didn't go to school, even though she knows the basic that, okay, before you can do this, you need to find out about the patient's allergy. I don't
Not
think.
just that. I was even just thinking now. Do you think maybe when she even started the IV, maybe it's not even in the vein?
Yes, it's possible. Maybe she didn't put the line in the right vein. Because for Mohbad to complain that they should remove it, that means the needle is in the wrong place. And she needs to check around the peripheral of the needle. Is it swollen? Is there any redness? I don't think she looked at all this. She didn't put all this into consideration.
Yes, I get you. Yeah, it's kind of like we don't even know. There's so many what if.
Yeah, on the
case.
video of the hand, you can see that the hand is swelling.
Yes.
It's maybe the needle is in the wrong vein.
It's very possible. And when she gave the tetanus injection, where did she inject it at? That's another
And
thing.
the
That's
arm.
the thing.
The arm.